individuals up to a certain amount of money coming into the household or no money coming into the household.
Thank you, Congresswoman.
Thank you.
Right now we've got. Oh, I'm sorry, Congresswoman. Right now, Congresswoman, we've got Wiley on the line with a question we'd also like to direct your way. Good evening, Wiley.
Hello, and first of all, I want to thank you for this very informative opportunity in terms of explaining how to deal with this horrible disease. I called earlier because I really wanted, especially the congressman, to really confront this madness that the president put forth today about changing the protocol for dealing with this disease. Clearly, this is in interest of his own electoral reelection, and he's putting his own personal political agenda ahead of the lives of people. And I am particularly concerned about that, and I hope my representative, and I will write every representative in Illinois, to confront this madness. We're in a very difficult situation, and we need to put first things first. And the first thing is the lives and health of the American people. As for our own case, as I explained to the young lady earlier, we are seniors, and I can't recall the person who, the official or the expert who gave the earlier presentation about dealing with the young man coming home. But that's very, very informative advice, very detailed. It really helps me as I go out with my shopping thing. I now know what to do. I also want to ask the congressman to really applaud the IDPH for Illinois Department of Public Health for the information they're providing the public. A young woman gave a very good presentation.
Wiley, I'm so sorry to interrupt you, but we've got a lot of questions to get to. Can you just quickly ask one question so the congresswoman can get back to you?
I'm sorry. Thank you.
Congresswoman, do you want to follow up to some of that?
No, I assure you that we are, I can't speak for the president, but I know my colleagues and I are working really hard to see what we can do, about the virus, about supporting, all of our constituents. That is what comes first. I mean, we may not all agree how to get there, but we know we might have to compromise some, but we are working together to see how we can help our constituents deal with this virus and all that comes with it. So, but won't speak for or about the president at this time. But thank you for calling.
Thank you, Congresswoman. If you'd like to ask Congresswoman Kelly and our experts a question, please press *3. Right now, we've got Diana on the line, who's got a question I think has been on all our minds, and I'd like to open it up to our doctors and experts and you, Congresswoman, to answer it. Good evening, Diana.
Hello. I'm 87, and I'm mostly in the house all the time anyway, so it doesn't bother me. But I'm worried about a girl bringing my groceries. Should I leave them outside and leave them out there for maybe an hour or so, and then go with another bag and empty them into a different bag and then throw those away? And about the mail, should I touch my mail when it comes?
And to our doctors and our experts on the line, and Congresswoman, I'm just going to leave it up to you all and let you all weigh in.
This is Dr. Hilton. So first of all, congratulations on 87. I hope I get to 87 too. And as far as getting your groceries and things like that, I know that's very much on everyone's mind of what can I touch. My thought is, for one, I'm glad you're getting it delivered to your house. For one, that keeps you out of a busy center as far as going to the grocery store yourself. When the groceries are delivered, I think you can bring them into your home. That's completely fine. I just recommend, and it may get to the point that you feel like I am washing my hands all day long, but washing your hands, I can't stress to you enough how important that is, because it removes any infection that may be on your hands that you can't see. So if you bring let's say you have a gallon of milk, go ahead and bring it into the house. Go ahead and put it into the refrigerator, because we don't want that food to go bad, for one. But as soon as you put it into your refrigerator, without touching as many surfaces as you possibly can, immediately wash your hands. If you go into the refrigerator and you pour yourself a glass of milk, or if you make yourself a sandwich, before you do that, wash your hands. After you make your sandwich, wash your hands again. Your house is going to be your kind of safety net. And I think as long as you're making a practice of saying, at any time of the day, if I'm doing anything where I'm interacting with someone outside of my home, that I'm just taking the necessary precautions to make sure that I'm disinfecting myself and or any surface that I touch the bag. For instance, if you bring the grocery bag inside and you put it on your kitchen counter, just make sure you wipe the counter down before you use it again, if that makes sense. But yes, I think you can still go on and still have interactions similar to that. Getting your mail, I think you definitely can do that too. But like I said, just always, as in general, just wash your hands after you do anything with the outside world. I hope that helps.
Thank you for that. Dr. Puckrin, do you have anything to add? Dr. Puckrin?
Yeah, here in D.C., we're practicing safety in the home as well. So I can tell you what we're doing in our house. So we do bring the packages into the front door, but then we wipe them down. We wipe the packages down before we fully bring them in the house, and then we bring them in and transfer them into a safe container. And as said before, we wash our hands repeatedly after all of that. Particularly at 87, you want to be very, very careful. So taking a little extra step to wipe down the packages is probably a great idea.
Thank you, Dr. Puckrin. If you'd like to ask Congresswoman Robin Kelly and our experts a question, please press *3. Right now we've got Marcus on the line with a question who we'd like to direct to Pat Collier. Good evening, Marcus.
Good evening. Thank you for holding this town hall. So I'm probably younger than many of the people on this call. I'm a 23-year-old social work student. And my question was, how are our health systems making sure that people's psychosocial and mental health needs are being met? There's anxiety surrounding all of this, and social problems like homelessness, hunger, food insecurity a lot worse during a pandemic. So what are our health systems and government doing to ensure that those mental and psychosocial needs are being met, and what ways can social workers and social work students be used to help, do our part during this crisis?
Thank you for that question, and that's a great question. You may have heard recently that the governor announced the SERVE program. And if you're interested in joining, or if you have colleagues who are interested in joining, social workers especially who are interested in joining this fight against the coronavirus and would like to volunteer or enlist in that effort, they can visit www.serve.illinois.gov for all available coronavirus volunteer missions. Volunteers play a critical role in our state's response to all disasters, especially such as the one that we're facing. So if you or your colleagues have any time and are able to help, please visit, again, www.serve.illinois.gov for all volunteer opportunities. And also, in addition to the ability to serve and be of service to this community, we're also working with volunteer organizations to put together and to establish housing for our homeless and most vulnerable populations. So the state, we're in lockstep with our social service organizations to make sure that we have coverage for those vulnerable populations who aren't able to fend for themselves in this environment.
Thank you so much for that, Pat. If you'd like to ask Congresswoman Robin Kelly and our experts a question, please press *3. And right now we've got Elizabeth on the line with a question that I'd like to open up to all of our experts.
All of them is they give me extra set, but I'm saying, look, this is my question.
Wait, Elizabeth?
Yes.
Elizabeth, you're live with Congresswoman Robin Kelly. What's your question this evening?
Yes, I was calling to see if you get in contact with somebody with the virus, can you bring it back home to your family?
And let me just, for our folks on the line, let me just repeat that. If someone has a job and your coworker has the virus but maybe isn't disclosing that, how do you protect yourself? And actually, I'm going to direct this question to Dr. Hilton first.
Hi,
Dr. Hilton?
Thank you for that question again. So, yes. So if you come into contact with someone who has definitely tested positive, for one, I think with everyone, regardless if this person is tested positive or not, always try to practice social distancing, meaning that stay at least a good 6 feet distance away from people at work, which can be very difficult. I completely understand in certain circumstances, like if you're working in a grocery store, for instance. But if you practice those measures, it can help to reduce the risk of you getting infected. Also, washing your hands as much as possible at work and making sure you're avoiding touching your face will also help to reduce the chances of you getting infected. Now, if you come into contact with someone who is definitely tested positive and you've been in close proximity with that person, what we're asking people to do is to self-quarantine, meaning that for the next 14 days that you stay home. Now, the reason why we say that is that, like I said, 80% of all people who are infected, most have very, very mild symptoms, if any symptoms at all. So you may be feeling just quite fine, but you yourself may now be a carrier of that virus. And if you get in contact now with someone who has a weaker immune system or someone who has these higher risk factors, such as older people or people with pre-existing conditions, they may get the virus from you and it can make them sicker. And so what we say is for 14 days, that's how long this virus kind of incubates or kind of lives within, and it's able to be transmitted to someone else. So we say you stay at home, allow your body to process this virus, and hopefully your symptoms stay just as mild, that you don't need any further treatments, you don't need to go to the hospital, but you keep yourself from infecting other people. Yes. And so sometimes people say, well, when should I get tested? If I know that someone is positive and I was in contact with them, should I get tested immediately? And the answer to that is no. If you're not showing any signs of an infection, if you're not having any chest pain, shortness of breath, any fever, then more than likely you're not going to be offered a test at this time. And to give an equivalent to that, it's just like, for instance, if you were to step wrong down some stairs and you kind of sprained your ankle, you wouldn't expect, even if your ankle was a little swollen, you wouldn't expect to come to the hospital and have an operation or have a CT scan or any MRI of your ankle, right? You would say, I need to give this a couple of days to heal itself and I'm going to be fine. It's the same thing with this virus. If you're not showing some really severe signs and symptoms or having any trouble with breathing, then what we say is stay home. It may be a couple crappy days for you if you're just feeling like blah, but if you're not having any problems with your breathing and no chest pain and kind of severe symptoms like that, then we say stay home, try to ride it out. But if symptoms get to be bad, definitely call your doctor, call the hospital first, because if you're calling somewhere, like if it's your primary care office, they may say, don't come to our primary care office because we don't have a test and we can't do anything for you. We would rather you go to this other location. So that will save you a trip from going out in the public to a place that can't help you, and can save you time and get you to the resources that are actually available to you. I hope that helps.
Thank you, Dr. Hilton. That was very helpful. If you'd like to ask Congresswoman Robin Kelly or our experts a question, please press *3. And Pat, right now we've got Mia on the line with a question that we'd like you to answer. Mia?
Okay. I just wanted
Mia,
to
what's your
ask,
question?
Hi, my question is I was concerned about like we have a massive incarceration going on right now in Illinois, and we have the correctional officers that have to come in and interact, but because it's overcrowded in the jails and they can't practice social distancing and they don't have the essentials to try and wash their hands and prevent, the spread. How are we going to control the spread starting in the prisons that may affect the guards, or the guards may affect the inmates? Like, what are we doing to control the spread of the pandemic in the prisons?
Thank you for that question. We are looking at that closely. We get to issue official guidance on it for our jails and prisons, but it is a priority for the governor, and it's something that we are trying to resolve now, because we recognize that for those parties and those groups who are most at risk, the threat and the danger is greater for them. So we plan to, and by the end of this week, issue guidance on that for our jails.
And this is Robin Kelly. I just wanted to throw in, if you look around the United States, there have been states looking closely at it, like Pat just said, that have let some of their have released some of their prisoners because of the virus.
Thank you, Congresswoman. And actually, Congresswoman, right now we've got Mrs. Johnson on the line with a question for you. Good evening, Mrs. Johnson. You're live with Congresswoman Kelly. Ms. Johnson? I don't know what happened with the connection, but Congresswoman, her question was, how do we protect our children and the people who are essential workers?
Well, I think that we are our best weapons against this virus. We hear over and over about, washing our hands, don't touch our eyes, nose, or mouth, avoid contact with other people who are sick, don't meet in groups larger than 10, and, of course, always cover your cough or sneeze with a tissue, then throw the tissue in the trash. But also, I just got off a phone call today with many, many, many union leaders, and what they're asking for and what we hope to be able to provide are, masks and gloves where needed. Like when you think about all the people that come to work in the grocery stores or the pharmacies, and some may have masks. Like I was at one yesterday, and someone had on gloves and a mask, but everyone doesn't have that. So I think that's the other way that we, can help people, making sure they have the proper protection, because they don't know who they're dealing with either. But definitely, the 5 suggestions we keep hearing over and over, we definitely need to employ that, and we need to shelter in place as much as we can and social distance, and we need to follow all those suggestions.
Thank you, Congresswoman. If you'd like to ask Congresswoman Robin Kelly a question, please press *3. Right now we've got Jakara on the line with a question we'd like to direct to Alan Spooner. Good evening, Jakara.
Good evening. First off, I want to thank Congresswoman Kelly for her leadership during this time and for holding this town hall tonight. We really appreciate this opportunity to be able to connect with you and everybody else on the call. My mother has advanced dementia, and I understand that dementia, Alzheimer's, does not necessarily mean that she's immunocompromised. However, I am concerned in regards to our long-term facilities, the long-term care facilities, especially our memory care facilities, where they are literally locked in there, which is a good thing, but they are literally locked in there. And so we heard what's going on with DuPage County and that long-term care facility, and is wondering kind of what we're looking at federally in regards to how we're going to protect our senior citizens, specifically for me, looking for how we're going to protect our dementia patients in long-term care facilities.